In this chapter, we're going to discuss the brain and the cranial nerves. So the brain weighs only about 3 pounds, but it can process billions of pieces of information simultaneously. It's continuously receiving sensory information from all of your receptors and at the same time initiating a motor response that will control the effectors that cause an action to happen. So the brain helps us to be able to understand information, to create, and of course to solve problems, store memories, have emotions. Pretty important organ. So we'll talk about the brain, which is part of the central nervous system, and the 12 pair of cranial nerves that are part of the peripheral nervous system. To overview before we get into specifics, the brain is divided into 4 major regions, as you can see here in the image and the associated little information box beside it. The cerebrum is the main part of the brain. So it is the largest part, and it is where our higher mental functions are performed and interpretation of sensory input coming into the brain. It also is where we plan and initiate movements. The diencephalon is a deep area of the brain that you can see right here. This is important for processing and integrating and relaying information to the right part of the cerebrum. It also helps us to maintain homeostasis because that's where our hypothalamus is located and helps to regulate our biological rhythms or circadian rhythm. The cerebellum is posterior and inferior. Okay, so it monitors and helps coordinate movement. And then the brain stem, as you see here in purple, helps us to maintain homeostasis, also a limited number of reflexes, monitors our movement, and also relays information to the right part of the brain. When you look at the surface of the brain, especially there on the cerebrum, you'll see lots of folds and lots of grooves. Those folds are called gyri, and the depressions between the folds are called sulci. The deeper grooves, as you see right here, between the cerebrum and the cerebellum, and right here, and there's also one that runs right down the midline of the brain and would divide it into a sagittal section. Those are called fissures. Fissures are very deep grooves. A TBI, or traumatic brain injury, is an acute brain damage due to an accident or trauma. A concussion is the most common type of TBI, and it's characterized by a temporary sudden loss of consciousness following a blow to the head or sudden stop of movement. Typically, the patient will have headache, drowsiness, lack of concentration, amnesia or memory loss, and typically confusion as well. Multiple concussions have a cumulative effect, causing the person to lose a small amount of their mental ability in correspondence with each episode. It's been related to long-term personality changes, depression, and a decline in intellectual ability. Athletes are especially prone to concussions, especially people like football and soccer players that are at greater risk for these changes. Now, a lot of sports organizations have really been called out for not being active enough and aggressive enough in helping to protect the players of that particular sport from receiving concussions. Now, the NFL has put in place several protocols for dealing with potential concussions, and the protocols then take a very cautious route as far as allowing an athlete to come back into play if they do suspect a concussion. A contusion is bruising of the brain due to a trauma, and that allows blood to leak from small blood vessels into a fluid-filled space around the brain. One particular concern is rare but serious, and that's called second impact syndrome. And this is where a person experiences a second brain injury before the first one heals completely. So it is so important that the first TBI completely heals before you allow that person to go back out and start putting themselves at risk again by playing the same sport or doing the same activity. I was reading in the textbook, and it said that there has been some research into treating TBI patients with progesterone infusions, and it was shown initially that they made a faster and better recovery than people that didn't receive the progesterone therapy. But unfortunately, continued trials and research, and I mean hundreds and thousands of patients were recruited to take part in this study, and unfortunately the results did not duplicate those initial results. So we are still looking for a more effective treatment for TBIs. The neural tube is a hollow tube that will develop into the brain and the spinal cord in the embryo. Neural tube defects happen and can cause serious deformities of the brain, the spinal cord, and the meninges that are the coverings of the brain and the spinal cord. So if you are pregnant, taking vitamin B12 and folic acid can help lower the risk of these developing. Now, some of the things that can happen because of this is something known as anencephaly, which is when there is incomplete development of the brain. Typically, the infant will not survive this. Spinal bifida is a failure of the neural tube to close near the caudal or tail end. Now, there are two types of spinal bifida, cystica and occulta. So here you can see the cystica. So here is the spinal cord. Here is a part of the vertebrae, but it did not completely form properly and allowed a fluid-filled cyst to develop here, filled with cerebrospinal fluid. Now, this will typically cause a blister-like formation on the back of the infant with this, which of course looks like a big fluid-filled blister and can rupture very easily. So there's no vertebral arch, which is this part right back here, and that large cyst develops on the back that can lead to paralysis. And if it is discovered early, there can be surgery done on the fetus. Spinal bifida occulta is when you have most of the arch formed, but you can see right here there's a little piece missing, so there's a partial defect there in the bony arch of the vertebrae. Now, this is much less serious and more common, and also, strangely enough, it is typically marked externally by a little tuft of hair and a dimple visual on the superficial surface where that occulta or that incomplete arch is located. The brain and the spinal cord contain both gray and white matter. The gray matter is made up primarily of cell bodies, dendrites, and unmyelinated axons. The cortex is the superficial layer of the brain. So you can see the cortex out here. That is that darker area. We commonly call that gray matter, even though it's really not gray. But it is the superficial layer of the gray matter. Nucleus refers to an area or center within the brain that is also composed of gray matter. Your white matter is made up of myelinated axons, so the lighter color that you see here in this frontal section, that is white matter. Myelinated axons are wrapped in bundles called tracts, and we'll talk more about those, especially as we get into the spinal cord. However, there are tracts located within the brain as well that connect one brain area to another. The brain is protected by several different structures, which include the bones of the skull. That one should be pretty obvious. The meninges, which are connective tissue coverings. The cerebrospinal fluid, that is a liquidy cushion. And the blood-brain barrier that controls what passes from the blood to the brain. We'll look at each one of these with a little more detail. The cranial meninges are three connective tissue layers that separate and support the soft tissue of the brain from that hard, bony cranium. It also encloses and protects some of the blood vessels that supply the brain and helps to circulate that cerebrospinal fluid. From the deep layer to the superficial, we have the pia mater. So pia lies on the surface of the brain. Pia means tender. Now we're going to look at each one of these again in just a moment. We'll talk a little more. The arachnoid mater is the middle layer. So arachnoid, think spider. This looks sort of spider webby. And the dura mater is the outer layer of the meninges. Dura means tough. Okay, you want the tough one on the outside. All right, so starting with the deepest, the pia mater. First of all, pia means tender, mater means mother. So you want the tender mother next to the baby. The brain is our baby, right? So it is a very, very delicate innermost membrane that lies on the surface of the brain. And if you see these in lab, it will look like it is just shrink wrapped really tightly onto the surface of the brain, and it follows the gyri and the sulci, or the grooves and the bulges. It also houses a lot of very teeny tiny blood vessels that help to form and move that cerebrospinal fluid around. And I apologize for these pauses, guys. I'm used to recording on my touch screen, and I'm in my office today. So every time I swap slides and I'm getting ready for the next one, it takes me a moment to move the mouse around and get back over here where I need to be to pause. So just in case you were wondering. Next we have the arachnoid mater. Arachnoid refers to spider or cobwebby. So it is external to the pia mater. It's named because it has a delicate web of collagen and elastic fibers that we call arachnoid trabeculae. Deep to the arachnoid mater is the subarachnoid space. Excuse me. The subarachnoid space is where we find a lot of cerebrospinal fluid, and those arachnoid trabeculae extend through the space from the arachnoid to the underlying pia mater. So both the arachnoid trabeculae and the cerebrospinal fluid support the arteries and veins within that subarachnoid space. In addition to that, you can see here these little arachnoid villi that project into the dural sinus for returning cerebrospinal fluid. Now that subdural space is a potential space that can fill with blood if the vessel ruptures. And there's nothing on this slide but the image, so I did want to show you here. You can see the pia mater. Remember, the tender mother lies on the surface and holds the baby. So there's your nice smooth pia mater. And if you look over here, all this stringy webbiness, that is your arachnoid mater. Dura means tough. So the dura mater is the most superficial, and you can see it here as indicated by this light tan area. So the tough mother is closest to the outside to be protective of the brain tissue itself. So it is a tough layer with two sublayers called the periosteal layer, perioste, around the bone. So it is the layer that is right there deep to the cranial bones, and the meningeal layer, which forms the dural sheath. It is the inner lining. So the layers are fused together except at areas like you see right here, which is a dural venous sinus that can help to drain blood from the space. Sorry, I just realized I said space. I should have said the brain. And I was looking ahead here at the epidural space. So epidura, above the dura. Okay, so the epidural space is a potential space between the dura mater and the brain. It contains a lot of the arteries and veins associated with the brain tissue. And before we move on, let me jump back up here to the top. The very first bullet is the subdural space. So epidural, above the dura, subdural, below the dura. So that is this area right here. And that, of course, can expand and fill with blood if there is a vessel that gets ruptured. And just like we had a picture to show you the pia mater and the arachnoid, here you can see that tough outer layer of the dura mater. And, of course, all these little stringy things you see, those are fibers that connect the dura mater to the cranial bones. When blood pools outside of a vessel, it's referred to as a hematoma. So an epidural hematoma is blood pooling in the epidural space of the brain, and that's usually due to a blow to the head. The adjacent brain tissue is going to get pushed on and compressed and distorted because of that hematoma continuing to increase in size. This can lead to severe neurological injury and death if the bleeding is not stopped and the blood removed by drilling a hole in the skull, suctioning out the blood, and ligating or tying off the bleeding vessel. A subdural hematoma is a hemorrhage that occurs in the subdural space. Now, this can be the result of ruptured veins, either by fast or violent rotational motion of the head. The blood is still going to be pooling in the space, and that compresses the brain. Usually occurs much more slowly than an epidural hematoma, but the treatment is usually very similar. Encephalitis is an inflammatory reaction within the brain. It's often caused by a viral infection. Symptoms include drowsiness, headache, fever, coma, neck pain, and paralysis, and possible death. And next we have meningitis. So meningitis, itis, remember, always tells you inflammation. The first part of the word tells you what is inflamed. So meningitis, inflammation of the meninges. Now this can be bacterial, viral, or fungal. It spreads through inhaling respiratory droplets or saliva. The symptoms include fever, headache, stiff neck, vomiting, hallucinations. And a lumbar spinal tap is used to remove cerebrospinal fluid to test for the presence of this inflammatory response and the causative agent. There are vaccines that can help to protect against meningitis. And these vaccinations are recommended highly for young adults and military recruits. Now think about that. What are they doing? Attending school or college or the military, where they will be exposed to a lot of people and therefore more likely to contact the meningitis infection.